need to improve funding for public health infrastructure. Funding has been cut for public health since 2002. 45% of Americans have nothing in a savings account. Another 24% of Americans have less than $1,000. 51% of Americans avoided medical care due to inability to pay. You need to call both your representative and your senator to ask them to support the Health Care Emergency Guarantee Act.
Before COVID, there were about 37 million people in this country who had no insurance, and about 41 million people who had inadequate insurance, meaning that they were underinsured, requiring more than 10% of one's income. Medicare for All saves about $450 billion annually, according to the Lancet article, and it saves 68,000 lives per year.
Headline, Goldman Sachs asks in biotech research report, is curing patients a sustainable business model? That seems to go against everything that we believe a healthcare system should be focused on, and it is disturbing to say the least.
So I volunteered in both an adult cancer center and a children's cancer unit for several years, and I've worked with lots of different families during that time. And the common thread among them all is a constant concern about finances, in addition to the already constant worry about their family members' health.
As a young person with a bright future and a health condition I was born with and I couldn't control, and like happens for many Americans with exorbitant medical bills, that bill went right in a pile until I was sued by the system.
I am Tim, and I am from the great city of Robbinsdale, Minnesota.
Originally from Stillwater, Minnesota.
I didn't grow up in the U.S. I actually grew up all over the place, mainly East Africa. I've lived in Kenya, Uganda, Tanzania, South Africa.
My name is Neha, and I'm originally from Minnesota.
My name is John Daniel. I'm originally from Iraq. Actually, today marks my 10-year anniversary in the United States. So I'm a second-year medical student at the University of Minnesota.
The role of stories is really crucial to talking to people about a given issue. And I think Brene Brown does a lot of research, and I love her quote. She says, stories are essentially data with a soul.
The first time I had a patient that had a bake sale to pay for their medical bill, I didn't know what to do. I mean, do you go to the bake sale? Or now it's GoFundMe. We need to focus on bringing our colleagues on board, which is hard and takes a kind of a different conversation than speaking at a Rotary meeting.
I am interested in this work for many reasons, but I think one of the most pressing right now is the fact that I'm in medical school. So if I don't become part of the solution, I'll be part of the problem.
What you encounter in healthcare settings is some people are getting treated differently from other people. And most of it has to do with reimbursement.
Moral hazard is this idea that if you're insured, you're going to spend more on healthcare.
Healthcare is not like food. It's not like the more we can get, the better. Every one of us wants more healthcare if we're not getting enough. Very few people want to go in and see the doctor all the time.
Maternal mortality, the reality is in terms of the poorest Canadians, the poorest 20% of Canadians do better than the wealthiest 20% of the U.S.
All of these countries, with the exception of the United States, has what we call universal health care, where everybody in the country has access to health care.
You want to know what Medicare for All would cost? Nothing.
And wiping out all that administrative waste would save, that's $4 billion in the first year alone.
Both bills have universal coverage, single public plan. They're comprehensive.
Incredibly encouraging, especially because of all you guys, because I believe it'll happen. It's just a question of time.